Hi, welcome to Pregnant After 40 Diaries. My name is Esther, and today we're going to be talking about the topic, the complete preconception blood panel explained, what every woman over 40 must test. If you're new to this channel, you're welcome. If you're planning to get pregnant, there are critical blood tests that you must do first. And many women, especially women over 40s, completely miss out on them. This test reveals hidden tissue issues about fertility, the pregnancy success, and even your baby's health. In this video, I'll walk you through the complete preconception panel and what each of them really means, each of the results really means to you. The first one is hormonal tests. Hormonal tests are important because we use them to measure the level of your hormones, the numbers that your hormones have. And the first one is the AMH. AMH is anti-millennial test. This is used to test the eggs in your ovary. That's the reserve eggs in your ovary. Bearing in mind that once women are 40 and above, the number of eggs in our reserve declines drastically. And so AMH test helps us to know the number of eggs in our reserve and our chances of getting pregnant. The next one is FSH, follicle stimulating hormone. For the AMH test, this test can be done anytime within the cycle, between our menstrual cycle. So for explanation, our menstrual cycle is the day after the last day of our menses. So for example, your menstruation is 5 days. The 6th day becomes the first day of your cycle. So you count it from that day onward until the first day of your next menstruation. So that is what I mean when I say your cycle. So for example, you have a 28-day cycle. It means the first day of that 28 days is the first day of the end of your previous menstruation. Then the 28th day is the day before the beginning of your next menstruation. So that is how the cycle is calculated. Okay, so the AMH test can be done any time of those days to calculate your egg reserve and the chances of you getting pregnant. There are some numbers attached to them. You have 1.0. Anything above 1.0 means you have a chance. Anything between 0.5 to 1.0 is there's a slim chance. Then anything less than 0.5, it means that the chances are very slim but not impossible. So these are things that you discuss with your doctor. The next hormonal test is the FSH, which is follicle stimulating hormone, your LH, luteinizing hormone, and your thyroid hormone. So these tests are done between the 2nd and 3rd day of your cycle. Why? Because these hormones are responsible for the growth and maturity of your egg. Your FSH, which is the follicle stimulating hormone, is responsible for the growth and maturity of your egg. And it is your follicle stimulating hormone that sends a message to your brain to begin the ovulation process. Now, the LH works hand in hand with your FSH in ensuring that your egg travels to your ovaries and begins to shield for ovulation, while your thyroid hormone regulates fertility in general. These 3 hormones are found in the pituitary gland of your body, and they are very essential because this is what triggers ovulation. When you find out that you have good egg reserve after your AMH test, then it is important to know that your hormones are balanced and they can produce. Because in our young age, it is very easy, or rather it is easier for the FSH to send signal to the brain to shield the egg and start the process of ovulation. But as we grow older, this task, we need to know how effective these tasks are so that we can know the effectiveness of our ability to become pregnant. Then the last hormonal test is the prolactin test. So the most important test, first of all, is knowing your level, your hormonal level. Now, I want you to understand something, that the number is not a be all and end all. You can have low number as per from your results. It doesn't mean that it cannot be worked on. It can be worked on with correct nutrition, with correct guidance and advice from your doctor or medical practitioner. The next test that is very important, blood work that is very, very important for women who wants to conceive, especially women over 40, is the general test. Number one is knowing your full blood count, because pregnancy is a business of blood. It is blood from the mother to the offspring, to the fetus. So you need to know your blood count. And the truth is, when you have good blood counts, the chances of you having a healthy and successful pregnancy is higher. And when you have a good blood count, it means that your baby, the tendency of your baby being healthy is also very high. The next is to know your blood sugar. Very important, because after 40, we begin to hear gestational diabetes for women. It means that the level of insulin, the sugar spike, is high, and so there's the risk of gestational diabetes. It is more prevalent in women over 40 and women that are obese. So it is important that this test is done every month. Like for me, my test is my gestational sugar level test, my blood sugar level test is done every month. So every month I go and do the test, because it is important for my own safety and for the safety of my baby. And it is also something that doctors advise you to do. So all the things I'm saying is you have to do them with the advice of your doctor. But first of all, it is important that you know about them and you are guided. And when you're asked to do this test, you already have a foreknowledge of them, and then it will help you in making better decisions. Okay, so another type of test that we're looking at is the general test. And the general test is like in some countries is sickle cell, knowing if your baby is if you as a mother is sickle cell or you are AS. And that is sometimes your partner comes in, your blood group of your partner comes in. So if, for example, you are AS and your partner is AS, then they need to know, the hospital, the doctors need to know the chances of you having a sickle cell baby. So these are very important tests. Then another type of test that is very important to have is, infection tests, to know whether you have any infection, like HIV test, hepatitis B or C test, rubella if you have rubella immunity. And in the hospital I attend, every month they also do the test on UTI, urinary tract infection. And sorry, I forgot to add that also the hospital I attend for my antenatal, the blood level is also checked every month. So the test I run every month is to check my blood level, my blood count, to check my sugar level, and to check for any infection, because these are very, very important routine tests that are advised for women over 40, pre-conception and in the pregnant phase. So what do results mean? Normal versus what needs attention. If you go for this test, or when you go for this test, bear in mind that they are numbers, they are signals. Like I said, they are not the be all and end all. So it means you need to have an open mind. When your numbers are not optimal, know that it is not the end of your desire. It is not the end of your wanting to become a mom. It's just telling you that things need to be worked on. And most of the time, how are things worked on? They are worked on based on nutrition. You have to tweak your nutrition to eat, so you check what you eat and know what can be improved. For example, you do a blood count and your blood count is less. Say, for example, the number is usually 32 and above, okay? And your number is 30. using myself as an example, what do I need to improve? I need to improve vegetable consumption. So I take more vegetables, I drink more water. Okay, I am not worked up, I am not anxious, because I know when you see these numbers, sometimes you feel like, oh my god, what am I going to do? Okay, but nutrition plays a very vital role in ensuring that you have a balanced hormone, you have you have a balanced sugar level, you have your blood pressure can to a large extent be balanced. So nutrition comes into play. Your sleep, regulating your sleep, having hygienic sleep comes into play, and also managing your mental health and stress also comes into play. Managing stress and cortisol, which is a video I've talked about before now. So what is my key advice? My key advice is, do not under any circumstance self-diagnose, because that is what we do by choice, in the sense that your doctor tells you this is what the problem is, and he advises you, and you go back home, you talk to one person, you talk to another person, you're like, oh, if this works for you, this can work for me. No, we are all unique in our pregnancy journey. So please do not self-diagnose. Do not say I know it all. Once you get pregnant, or you want to start the journey of being pregnant, please work with a doctor from a registered and recognized hospital with the right qualification. Work with a doctor. It is very important, so you are safe and your baby is safe and you have adequate knowledge. Then another thing is, once you get pregnant, you achieve the goal of being pregnant, start early. Start early to talk to your doctors, attend all your appointments, make sure that you are relaxed, make sure you're calm, because yes, the research and statistics tell us that it's very dangerous to be a mom in your 40s, to be pregnant in your 40s. And like I said, I am 43 years, I'm soon to be 44, and I'm pregnant, and so far so good. It's been a very calm and knowledge-based pregnancy. So what I'm saying here is that everybody can have a peaceful and calm pregnancy with the right information and the right tools. Okay, all right. So having said all this, if this video has helped you understand the blood work you need to do, the tests you need to do, the blood work test you need to do, please subscribe to this channel, because every other week, every other day, we have videos that are meant to help women that are in their 40s, in their late 30s, trying to conceive, already conceived, and trying to get through the task of everyday living, being pregnant at this time of our life. Please subscribe to this channel, because we have practical advice that would help guide to a successful pregnancy. And then please, if you have any woman that it's in this stage of her life, do share this video. Please be kind to share this video with them, so they too can be part of the community of women that are in their 40s and making pregnancy rock. So please stay tuned for our next episode, which promises to be very interesting. Until then, have a nice day.